So how does this all translate into a clinical settings? Example number first, breast cancer, histology 1-2 weeks after HIFU, and you can see compared to control on the right, increased infiltrations of dendritic cells and especially activated dendritic cells. Second example, prostate, again post-HIFU, very more acute time points, 3 hours post-ablation. And this is to monitor the expression of heat shock protein expressions. Center of the HIFU treated zone, transition zone on the right here, and you can see this massive increase upregulation of heat shock protein. So several clinical studies reported stimulation of some degree of immunization to tumor-associated antigens following treatment, increased danger signals expression, including heat shock protein, changes in peripheral NK cell activity, CD4, CD8 T cell population, increased infiltration and activation of dendritic cell, macrophages, T cell, and so on. But we still, again, as in preclinical settings, lacking this overall understanding, mechanistic understanding of what therapeutic ultrasound intervention will lead to what kind of modulation of the immune response. What is very interesting also and very exciting is we have some case reports of abscopal response, meaning you treat at one area and you have a response that is systemic and that is observed at an untreated area. This is a case of pancreatic cancer. This is a tumor pre-HIFU. This is post-HIFU. The treatment was effective. And very interestingly, you see that these untreated lymph nodes here on the right, before and after HIFU of the pancreatic tumor. And you see a total regression of the tumor in the lymph node, again, signaling an abscopal, a distant effect response. Second example, histotripsy, mechanical ablation of liver tumor. Again, on the top, this is a tumor before and after. This is a treatment site. And in the bottom, in the quadrant, you see before, day 1, week 8. These are site reduction in this other metastases in the liver that were not targeted by histotripsy. There are a couple of clinical trials that are ongoing. One is now completed, the first one. It was focused ultrasound and anti-PD-1 in metastatic breast cancer. There is a new clinical trial ongoing in UVA, again, thermal ablation. So this is sparse thermal ablation with anti-PD-1 for solid tumor this time. There is a clinical trial on breast combining, again, gemcitabine and sparse thermal ablation. And finally, there is a clinical trial ongoing for opening the blood-brain barrier to deliver anti-PD-1 to brain tumors. And in parallel, and with the Focused Ultrasound Foundation, we are especially pushing for that. There are ongoing immunomonitoring clinical study, meaning that clinical study using ultrasound as a monotherapy, and that implements in parallel monitoring of potential changes in immune response in these patients following ultrasound interventions. So ongoing is prostate and pancreas, and more to come.